has been,
highest stakes.
well, yeah, like he said, what's an extra 30 seconds? Really, it's not a big deal. It's not going to help you.
Okay.
Well, this extra 30 seconds won't help you, so.
Is it working now? Seems to be. Okay. Okay, 1 minute for your stem.
Hi, I'm June, the pharmacist. How can I help you?
I'm just here to fill a prescription.
Okay, for sure, I can definitely help you with that. And what is your name?
It's Susan Adamson.
Susan Adamson, okay. And just your date of birth to confirm?
It's December 30th, 1983.
Okay. And sounds good then. So I can for sure process this with you. But I guess just before we get started, is there anything else I can help you with today?
No, I just need need that prescription filled.
Okay, sounds good. So with that then, I'll go with a little bit of, talking with you a little bit about what this is for, and then going through a little bit of your medical history just to make sure that this drug will be the right one for you, and then we can kind of go from there.
Okay.
How does that sound?
Sure.
Sounds good?
Yep.
Okay. So I guess with the valproic acid, what did Dr. Ward say about it? What was it for?
Well, I have to defend my thesis at the end of the month, so I'm looking for something to help with my migraines.
For your migraines? Okay. Did he tell you anything about that at all?
No, my other medication that I tried didn't work, so now I'm going to try this one.
Okay. And what was the other one that you tried?
The propranolol.
Propranolol? So that didn't work at all, I guess?
Not really.
Okay. And in terms of that, how many migraines did you usually get in the past month?
I usually get about 2 to 3 a week.
Oh, 2 to 3 a week? Okay.
Mm.
And you've been, I guess the propranolol, taking it daily kind of thing? You didn't seem like it helped at all?
Yeah, I was taking it twice a day, and no, it didn't help.
Okay. And just going back to the migraines, what kind of symptoms are you kind of experiencing with that?
It's usually just like a really bad throbbing pain on the right side of my head.
Throbbing on the right side?
Mm.
Okay, and how long does it usually last?
It's usually about 4 hours.
4 hours? Okay. It does sound a little bit painful and frustrating to deal with for sure.
Yeah, I've got a lot to do, so it's
Yeah.
definitely interfering with my
Your
research
quality
and
of
everything.
life? Yeah, okay. And I guess, is it always like that same constant pain, or does it peak at a certain level? Or is it like same constant pain for the 4 hours?
It usually kind of comes on a little more gradually, and then it's just there all the time. So.
Do you get anything that kind of hints at you getting a migraine, like any flashing lights or?
No, it's usually gradually
Okay.
comes on.
Okay. And I guess recently, have you noticed any change in health, such as like a fever or stiffness in your neck kind of thing, or just
No,
not really?
not really.
Okay. So this has been going on for quite a while, I guess. For how long so far? The
I've had migraines for about 5 years.
5 years, okay. And then you said recently it has gotten worse, or?
Yeah, in the last 6 months, I feel like nothing's really touching it anymore.
Okay. And I guess in terms of medication, you were saying that propranolol doesn't seem to work much anymore. I also see on your file that you had Maxalt. Does that one seem to work for you?
It did when I first started using it, but it's not as effective anymore. Like in the last 6 months, I'd say it's been worse.
Okay, how have you been using it?
Every time I get a migraine, I will take one of those.
Okay, do you take it again after 2 hours, or do you get some relief after?
Once in a while, I will.
Once in a while, okay. So I guess in the past month, let's say, how many have you used of the Maxalt?
Well, I get about 2 to 3 migraines a week, so
Every single time, I guess?
I'd use it every
So
time I get
maybe
a
about like
migraine.
12 times a week, 12 times a month, I guess?
Yep.
Okay, sounds good. so that's unfortunate. It doesn't seem to be working anymore. So hopefully this will, for sure, help with that. Did you find anything else that seemed to help with the migraines?
Sometimes I'll take a Tylenol if it's still really bad, but that's about it.
Okay, so you would just take the Maxalt, I guess. So then the Tylenols are just like a breakthrough kind of thing.
Yeah, I guess.
Okay. Anything that you find it makes it worse?
I have a lot of deadlines with the I'm doing
Mm.
for defending my thesis,
Yeah.
so I've got lots of stress with that. So
Yeah. So do you find, I guess
So it
it kind
definitely
of
makes it
peaks
worse.
with the stress for
Yeah.
sure. It's the overwhelming kind of nature, and I guess it being there doesn't really help at all with the stress kind of things. Makes you
no,
more
it's
frustrated.
definitely really interfering with my. I don't want to have to postpone it.
Yeah.
So.
Okay. So then I guess the therapy to help prevent you getting migraines will be really beneficial for you, for that as well. And I guess one more question as well. I see that you're on Marvelon. Do you notice that your migraines kind of peak during when you have your period at all, or?
I noticed that they used to, but recently it's just been whenever.
Just whenever?
Yeah, been more frequent, and
Okay.
it's just mostly with the stress. Every time I get really stressed out,
Okay.
that's when I notice they're worse.
Okay, sounds good then. So I guess with that, I'll just do a quick, brief history just to make sure that everything is set in order, and then we can start talking about the medication.
Okay.
Okay, so I guess in addition to just the migraines, do you have any other medical conditions?
No.
No? Okay. And then in terms of, I guess, a little bit of your social history, because sometimes like alcohol smoking can make migraines worse. So have you ever used tobacco products before?
No.
No? Okay, no tobacco. And I guess how often do you usually drink, or how many glasses do you usually drink in a week of alcohol?
I might have 2 to 3 drinks once in a while, but it's been pretty busy recently, so
I guess not too much
not
partying.
very much. No.
And
not
how
a lot of
about
time for that?
caffeine or coffee?
No.
Not really? Okay. And then I guess with the sleep, is that affected because of the stress?
Yeah, I feel like I sleep better on the weekends, but I'm usually pretty tired during the day.
Okay. Do you think that affects your migraines too, or?
Yeah, I think
Okay.
it could.
Okay.
Yeah.
Okay, and then with that as well. And I guess in terms of allergies, what allergies do you have?
I don't have any allergies.
No allergies? Okay. And medications, we have here that you were on propranolol, as you said, the Marvelon, and then the Maxalt as well. Are you on any other medications?
Nope.
Nope. How about anything over the counter? You were saying Tylenol?
Yeah, Tylenol I do
Tylenol
once
just
in a
every
while,
once in a
but
while.
that's it.
Okay. Anything herbal products at all?
Nope.
No? Okay. That sounds good. So I guess we'll go into a little bit of this as well. So with your migraines, it sounds like since it recently was okay, and then 6 months ago we started getting really bad, and I guess you've been taking more of the Maxalt, so probably up to maybe 12 times a month. So another possible factor is that sometimes if you take too much of the medication, you can actually get even more headaches. So I would recommend at this point trying to go with what the doctor suggested and doing a more preventative therapy, and maybe cutting back a little bit of the Maxalt. Because sometimes using too much can make it worse. So would that be okay for you to maybe try to limit the use of the Maxalt?
Yeah. What if I get a headache or if I get a migraine? Can I still take it?
I guess in that case, maybe because I'm guessing part of the issue may be that you're taking 2 of the Maxalt, and then your body's kind of gets another headache because of that. So I guess alternatively, you can do what you did with the Tylenol. Maybe try that instead. But hopefully, with the prevention therapy, you won't have to get as many migraines that you would have to use that.
Okay.
Do you think that would be okay?
Yeah.
Okay, so Tylenol. How many do you usually take for your migraines?
I maybe take 3 to 4 doses a week, so it's not very much.
Okay. So I guess in the terms of a migraine, if you do get it, maybe take 2 caplets of the 500 milligrams kind of thing. I can probably show you where that is after. But
Yeah, I usually just take 500 milligrams.
okay, then if that seems to work, then 1 should be okay too. Okay, because I guess ideally with this prevention, we want to kind of work down and stop getting you so many of the migraines. So maybe instead of 2 to 3 times a week, maybe just once a week would be our goal kind of thing.
Okay.
Okay. So now with this preventative therapy, as I said, we're trying to reduce it maybe half of what you're getting now. Like we
Okay.
can't get complete clearance, unfortunately, but
Yeah, I
we
just
will.
need to be able to cut it down enough
yeah.
so that I can finish my research and
Okay.
everything.
So this valproic acid, with the prevention therapy, it's not kind of like your immediate relief as you'll get with the Tylenol or the Maxalt, but it kind of works as we discussed already to prevent another migraine. So usually you'll see the effects maybe in like 2 or 3 weeks kind of thing. But usually we want to give it a good test before switching to another medication, like 3 months or so. kind of like what your doctor did for the propranolol. 3 months doesn't seem to work. Let's try something new,
Okay.
kind of thing. So we're gonna go with that. And I guess, as I mentioned earlier, our goal would be just try to get your migraines down to maybe max once a week, so you can concentrate on your studies.
Okay.
Okay. Again, if it is still a problem, like you still continue to get migraines just as often, do feel free to call the pharmacy because they're just other painkillers, kind of thing for you.
Okay.
Okay. And in terms of how to take it, it's just 1 tablet twice a day. And since this is preventative therapy, we do want to try to get the daily, keep taking it daily. Would that be something you could still incorporate into your schedule?
Oh yeah.
I guess, for sure.
Yeah.
Okay. Okay. And I guess in terms of side effects, this one can cause a bit of drowsiness, I guess, which might not be beneficial at this time because of your studying. But I guess if you find that
It's
it
better
really
than the migraines.
Oh, okay. That's true. But then again, if you find it disruptive, feel
Okay.
free to call us as well. And we can try to talk with your doctor or rearrange something that we can change for you. Maybe pick a different agent,
Okay.
kind of thing. Okay? So at this point in time, what other questions or concerns do you have?
Well, this sounds like a medication my friend takes for her seizures. Does that
Mhm.
sound right?
It can be used for both. Sometimes it can be used for seizures, and as well, sometimes it can be used to prevent migraines as well. I guess the one you tried last time was first not, but then that's as well.